I just want to get back to life. I just want to get back to normal. I want to see my kids. I want to go back to work.
Well, emotions run deep for a Houston area woman driving to get in line for her COVID-19 vaccine. She feels the pressure so many Texans feel right now and the deep desire to get vaccinated. Well, starting tomorrow, Texas will distribute vaccines for the 4th week in a row. Health officials believe those vaccines will mean 1 million doses have been allocated across the state, but Texas leaders had projected having more than 1 million by the end of the year. Mike Marut explains how the slowdown in vaccine supply changes the outlook of things.
According to the Department of State Health Services, Texas has received just shy of 700,000 doses of COVID-19 vaccines before the year ended. That wasn't quite the plan. As Governor Greg Abbott tweeted before Christmas, Texas would receive more than 1 million doses by the end of 2020.
It'll take quite a few months here before the supply and the demand really starts to balance out.
Dr. John Zerwas is on the expert vaccine allocation panel, making recommendations on where the vaccines go and who gets them next.
It is the light at the end of the tunnel, but it is still a long, dark tunnel.
On Friday, DSHS said in a statement the CDC decides how many vaccines the state will get, how many go to long-term care facilities as part of a federal partnership, then DSHS divides up the rest.
We still are going to get our fair share based on population for the vaccine.
Right now, there are only 2 options, Pfizer and Moderna. Zerwas says that contributes to the slow supply.
We do expect a couple more vaccines pending FDA approval to come on board in the end of January, February timeframe.
The next vaccines to arrive in Texas will come this week, but DSHS has not said how many doses the state will receive or who will get them.
Sometimes we don't know until just days before. We have to determine where the vaccine is going to go across the state.
Now, as we get into week 4, people who were vaccinated during week 1 will get their second dose of the Pfizer vaccine. But according to the doctor in that story, those doses will not show up in the data breakdown of vaccines Texas will receive from the federal government. So here's what we do know at this point. The state's been vaccinating people in phase 1A for the last 2.5 weeks. That includes healthcare workers, long-term care residents, and first responders. And last week, phase 1B started. People 65 and older, and anyone 16 years or older. Now, that has a pre-existing health condition only. Now, here's a list of the conditions that will allow you to get the vaccine if you're under 65 years old. It includes cancer, pregnancy, and diabetes. Asthma and allergies are not on that list. And if you're a part of the group 1B, you do need an appointment rather. Once again, you do need an appointment if you are in group 1B. Here in North Texas, Dallas County is the latest county to start pre-registering those who qualify for phase 1B. Collin, Tarrant, and Denton counties are also either accepting appointments or pre-registering. For a list of providers, please go ahead and text the word vaccine to 214-977-6028. Once again, that number is 214-977-6028. It's right there on your screen, but know this, not every provider will have vaccines available for the people in this latest phase. This morning on